Hello guys, welcome and welcome to Metier Academy, one of leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. Who are you all? Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important MCQs, previously asked MCQs in competitive exams along with the rational golden points we are discussing. So watch the video till the end. Definitely it will be so much useful for you. There are so many Magic Pill videos streaming in our YouTube channel, that is E-Nursing Metier YouTube channel. So watch those videos also. So let's begin the session with your thought of the day. Don't worry about your failures. Worry about the chances you miss when you don't even try. Trying is very, very important. Till you reach your goal, we have to try. Keep on trying, make you success. You should not get frustrated. Okay. So with this thought, let's start the session. See, actually, this is question number 31 already. Part 1, part 2 videos it is streaming in YouTube channel. So watch those videos also. Okay. So this is the part 3 video. So let's start the session. A patient on renal dialysis complains on gastric discomfort and reports of taking over-the-counter antacids regularly. Okay. So what the first point says, always from the question, you have to take the key point. Okay, whether the question is 5 lines or 6 lines doesn't matter. Take the key point. That is very important. In the first sentence, the key point is the patient is going for renal dialysis and also the patient is taking over the counter antacids. Okay, so the nurse understands that kidney function is impaired because excess electrolyte may accumulate in the body. Some excess electrolyte is accumulating within the body. So what electrolyte is that? That is the last sentence. Which condition should the nurse monitor for? Okay, so always in the question, two things are important. The first one is key point and second one is the last line. So here over the counter antacid the patient is taking, the patient is also having renal failure. That's why renal dialysis is going on. So which electrolyte is accumulating within the body? This is the question. Understand, right? So for this question, the right answer is going to be what? Hypomagnesemia, hyperkalemia, hypermagnesemia, hyponatremia. 4 options are there. So which is going to be the right answer? So here the patient is taking antacids. Already the patient is having acute renal failure. So some electrolyte, one important electrolyte excretion is going to get affected. If the patient is suffering from renal failure, the magnesium is going to not going to excrete from the body. Magnesium. Okay, so magnesium is not going to excrete from the body. At the same time, the patient is taking antacids. See what the antacid contains. The antacid contains magnesium. A simple example, Gelusil. Before the food, for acidity and to treating the ulcer, we used to take what? Antacid, right? So this antacid contains what? Magnesium. So already within the body magnesium level is more, and this patient again taking a syrup, that is antacid syrup, which contains magnesium. Altogether it leads to what? Hypermagnesemia. So here the right answer is going to be what? Hypermagnesemia. And always the normal level has to be known to everyone, guys. Okay, so the normal magnesium level is 1.7 to 2.2 mg per dl. Please remember this. Okay, and other golden point, why not other options? I have given the rationale very clearly. Why not other options? That things also we used to discuss regularly, right? See, hypomagnesemia, that is not at all connected here because antacid contain magnesium. The acute renal failure leads to hypermagnesemia, right? So hypomagnesemia is not at all related to this question, so we can eliminate this option. Okay, usually hypomagnesemia, how it causes? Whenever there is a GI loss or continuously the patient is taking alcohol or diuretics. If these key points are coming in the question, means that time we can think about what? Hypomagnesemia. But here antacids, dialysis, kidney failure. Okay, so that's why we can eliminate hypomagnesemia. What about hyperkalemia? Yes, in acute renal failure, hyperkalemia might be there. Yes, definitely it might be there. But it is not related with the antacids. In this question, they are asking about antacids, right? So that's why we have eliminated hyperkalemia also. The next one is hyponatremia. See, it is not at all related to the question. Understand, right? Fine. So based on the key points, the right answer is going to be option C, that is hypermagnesemia. So this is how you have to solve the question, guys. You should know the rationale for each and every options. Okay, so the second question, yes, another key point, another golden point related to hypermagnesemia. This point also regularly asked in the exams. See, clinical manifestation of hypermagnesemia. See, You can see here, hypermagnesemia, increase in the magnesium will cause what? Decrease in all the functions, especially deep tendon reflux is going to be decreased, bradycardia, heart rate is going to decrease, respiratory depression, respiratory rate or respiratory failure can take place, at last cardiac arrest can take place. So in hyper, everything is going to decrease. In hypo, the symptoms are going to increase. Okay, in hypermagnesemia, what will happen? Increase in the deep tendon reflex, hypo, and tachycardia will be there. Okay, so in hypo, the things are going to increase, hypomagnesemia. In hypermagnesemia, everything is going to decrease. So this is how you have to remember. Okay, so this is all about the first question. The second question, a patient is undergoing intravenous pyelography with a contrast dye. During the procedure, the nurse observed the patient for possible adverse reaction. Which reaction should be reported to the physician immediately? So, intravenous pyelography means injecting the dye in the veins. After that, they will be taking series of X-rays in order to find the structure of the mostly renal system. Okay, so that is called as what? Intravenous pyelography. So, when we are injecting the dye, what are all the common symptoms we can expect? And which symptom, if it is coming, means it has to be informed to the doctor. So this is the question and key point. Okay, 4 options they have given here: angioedema, feeling of warmth, salty taste in mouth, flushing of face. Okay, right. So among the 4 options, the expected one is expected one. It is not at all required to inform to the doctor. Is feeling of warmth, salty taste in the mouth, and flushing face. So these things are expected symptoms after injecting the contrast. So which is going to be the right answer? The right answer is going to be option A, that is angioedema. What is that? Angioedema. Okay, right. See, you can see the rationale here. Clearly, I have mentioned each and every golden points. See, iodized contrast media, it will cause feeling of warmth, metallic taste, because the contrast will give metallic taste, and mild flushing. So these things can be expected after the contrast agent. But angioedema, that is swelling in the lips, tongue, face, and airway obstruction will be there in the angioedema. Please make a note of it. Okay, and airway obstruction, because it is causing, this contrast agent is causing severe allergic reaction. That's why this type of angioedema is there, and the severe form of angioedema is airway obstruction. Okay, so what we're supposed to do, it has to be informed to the doctor immediately. Understand, right? Fine. So the next question is question number 33. A patient with acute renal failure develops dangerously high electrolyte level. The doctor prescribed hypertonic glucose, insulin infusion, sodium bicarbonate to correct the imbalance quickly. One electrolyte is dangerously increased. For correcting that electrolyte, the doctor is prescribing 2 medications. The first one is hypertonic glucose with the insulin, and second one is sodium bicarbonate. So which condition is being treated? This is the question. 4 options again they have given: hypernatremia, hypokalemia, hyperkalemia, and hypercalcemia. Very simple question. Here the right answer is going to be option C, hyperkalemia. What is the key point here? See, the key point is very simple. Whenever you are seeing 2 things, that is insulin plus hypertonic glucose, mostly we used to give this insulin infusion plus hypertonic glucose to treat the hyperkalemia. At the same time, if the patient is having acidosis plus hyperkalemia, that time we will be thinking about what? Sodium bicarbonate. Understand? So for this question, the key points clearly stating that the patient is suffering from hyperkalemia. So here the right answer is going to be what? Hyperkalemia. Okay. So you all know that insulin and glucose together, what it will do? One by one I will explain. Insulin, it will shift the potassium from the blood vessel into the cells. Okay. So in the blood vessels, in the blood, the potassium level is going to be decreased. So the potassium is corrected. At the same time, what will happen? If you are giving insulin, the glucose level will decrease. That's why we are giving hypertonic glucose solution also. Understand? And the next one is sodium bicarbonate. Already I said that if the patient is having acidosis, at the same time hyperkalemia, that time we can go with the sodium bicarbonate. Okay, so this is how we have to solve the question. The next one, question number 34. A patient is diagnosed with Hydatid cyst. Disease affected the liver. The nurse learns that the parasitic infection most commonly affect the particular lobe of the liver. Which lobe is most commonly affected? caudate lobe, left lobe, both right and left lobe, and right lobe. 4 options they have given here. Here the key points are hydatid cyst disease. If you know about hydatid cyst disease, easily you can answer the question, because this hydatid cyst disease commonly affecting the liver. And this hydatid cyst disease, it is a parasitic infection. So these are all the key points. Wherever I have marked with the red marker, it is a key point. Okay. So here the question, the last line is very important in every question. Which lobe is most commonly involved? This is the question. So here the right answer is going to be what? Right lobe. Right lobe is the largest lobe in the liver, and it consists of enormous amount of blood vessel and blood. So it will be easy for the organism to multiply very easily. Okay, in the right lobe, because the size of the right lobe is very big with rich amount of blood supply and nutrition. Understand? So this hydatid cyst disease, it is a parasitic infection transmitted from the dog, and this is a parasitic. Worms will be present. So this worms, small worms are called as larva. This larva is going to accumulate inside the liver and it will multiply. Once the cyst is break down, that time anaphylactic reaction will take place. I will show the image and I explain. Okay. So whatever I have explained, it is here. Let me show the image. So this is the right lobe and this one is the left lobe. Okay. You can see the pathology here. From the dog, echinococcus egg. From the affected dog, echinococcus egg is coming out in the dog stool. So human accidentally swallow the echinococcus egg through the contaminated food, water and hands. Okay, and the head hatches in the intestine and releases the tiny larva. And this tiny larva, it circulates in the blood and reaches the liver. In the liver, it will make a cyst, and inside the cyst, it will multiply. At one particular point, the cyst will break down. That time, antigen-antibody reaction will take place. So that time, which antigen-antibody reaction, which immunoglobulin will increase? IgE immunoglobulin is going to increase. Understand, right? So this is the pathology of hydatid cyst disease. Understand, guys? So right lobe is most commonly affected when compared to the left lobe. Okay, right? So clearly I have mentioned here, from the dog stool, human ingested the eggs of the echinococcus. It reaches the intestine and larva is hatched out, and the larva will circulate in the bloodstream and reaches the liver. In the liver, it makes a cyst. Once the cyst gets ruptured, it leads to anaphylactic reactions. Understand, right? So this is the pathology. The next one, question number 35. A patient is scheduled for gallbladder surgery due to gallstones. Due to gallstone, the nurse reviews operative plan and understand that commonly used abdominal incision. Only 2 key points, guys. Okay, let me complete the question. Which incision is most commonly used? See, for reaching the gallbladder, what type of incision is commonly used? This is the question. Identify the key point from the question. That is very important. Understand? So 4 options they have given here. McBurney's Gradrian incision, Cochlear's incision, and Phenolsteal incision, and left paramedian incision. 4 options they have given here. Okay. See, for reaching the gallbladder, what incision we supposed to do? Cochlear's incision. What incision? Cochlear's incision we supposed to do. How the Cochlear's incision will be? Where, in which part of the abdomen we supposed to do the Cochlear's incision? Everything we will discuss. Let's discuss one by one. So for this question, the right answer is option B, that is Cochlear's incision. Okay, right? So let's see the rationale. Cochlear's incision, for reaching the gallbladder, biliary tract, liver, we have to do the Cochlear's incision. Okay, right? You can see here. So this is how the Cochlear's incision will be. Okay, Cochlear's incision. Okay, to reach the gallbladder, liver or biliary tract, we have to do the Cochlear's incision. The next one is McBurney's. What is the other name of McBurney's? Gryderon incision. Gryderon incision. Okay, so this is the other name of McBurney's. So for appendectomy, we have to do the McBurney's incision. For cesarean section gynecological surgery, we have to do the Phenolsteal incision. And for upper abdominal surgery on the left side, we have to go with the paramedian incision. So these are all the golden points, guys. You can see here along with the image, Cochlear's incision already I have explained. Cochlear's incision for the gallbladder. So this is the Cochlear incision. Okay, and next one is McBurney's incision. Where it is? This is the McBurney's incision. It is a vertical incision. Vertical incision. Okay, McBurney's incision on the right lower abdomen. And phalansteal incision. This is the phalansteal incision. Okay, like a C-section. Okay, for the gynecological procedure, they will go with the phalansteal incision. The next one is Rutherford incision for kidney transplantation. You can see here, this is the Rutherford incision. Okay, and last one is Lance incision. This is also for appendix. You can see the Lance incision. This is the horizontal incision. McBurney's is a vertical incision. Lance incision is the horizontal incision. Okay, so these are all the key points, guys. Again and again, watch the video and memorize these things. These are all memory-based things. Okay, so question number 36, a patient with a long-term alcohol use is diagnosed with alcoholic liver disease. The pathological report mentions mammary degeneration in the liver cells. Very important question, repeatedly asked question. The nurse understands that this degeneration is the form of hyaline, amyloid, hydropic, fatty degeneration. 4 options are there. See, mammary degeneration is the key point. If you know about the mammary degeneration, immediately you can select the answer hyaline degeneration. Hyaline degeneration is nothing but it is the mammary degeneration commonly occurring in the liver. Where it is occurring? It is occurring in the liver. So here the right answer is going to be what? Option A, that is hyaline degeneration. Let's discuss the golden points. Mammary bodies, it is also called as mammary dink bodies. Okay, how it looks? It looks like a hyaline inclusion. What is this hyaline? You can see here. See, let me explain the pathology so that it will be easy for you to understand. Alcohol damage the liver cells. Once the liver cells are damaged, from the cells, a protein will be released. That protein is going to accumulate inside the hepatocytes. You can see here, these are all the hepatocytes. This is one hepatocytes. Okay, so inside the hepatocytes, you can see a pinkish color, worm-like structure. This is called as what? Hyaline, mammary degeneration. How it happens? Because of continuous intake of alcohol, the cells of the liver is getting damaged. From the cells of the liver, a protein is released out, and the protein is giving a color that is called as pink color. Okay, inside the hepatocyte, this pink color is present, means that is called as what? Hyaline inclusion, also called as mammary bodies. Okay, so why it is happening? It is because of etiological factors like chronic alcohol history, alcoholic hepatitis, cirrhosis of the liver. In all these conditions, the protein will be released from the liver cells and the protein is going to accumulate inside the hepatocytes. The structure color is going to be pinkish hyaline color. As I mentioned here, as I shown here, it is like a tapeworm, right? So this one is called as what? Mammary bodies or hyaline degeneration. Understand, guys? So that's why we have selected option A as a right one. Okay, right? So question number 37, a patient is admitted with a severe abdominal pain and diagnosed with acute pancreatitis. Very important question. The healthcare team uses a scoring system in acute pancreatitis. What scoring system will be used within 48 hours to find out the severity of the disease? They are asking about the scoring system in acute pancreatitis to identify the stage and severity of the disease. 4 options they have given here: Ranson scoring system, Glasgow Coma scale, Apgar score, Child Pug score. Here the right answer is going to be option A. For acute pancreatitis, Ranson scoring system is used. It is used in the first means after the admission of the patient, within 48 hours it is used. Within 48 hours, that key point is also mentioned here. Okay, so Ranson criteria are used to check the acute pancreatitis severity of the disease. It is used, the Ranson score, it is used in the acute pancreatitis within 48 hours. Within 48 hours. Understand, right? What about other options? Ranson scoring system, it is used for acute pancreatitis. Already we have discussed that. What about others? Very simple, guys. GCS, you used to check it for loss of consciousness or level of consciousness. Apgar score for the newborn assessment. Child Pug score for assessing the severity of the liver disease, especially used in the cirrhosis of the liver. Okay, for pancreatitis, Ranson. For liver cirrhosis, Child Pug score. And for level of consciousness, GCS, and newborn assessment, Apgar. Okay, right? So question number 38, a patient diagnosed with hepatitis B undergoes blood testing to determine the level of infectivity and hepatitis B. Key points. The nurse understands that the specific marker indicates active viral replication, virus multiplication, and high infectivity. Which marker is used to check the active viral replication and high infectivity? And they have given 4 markers, that is HBsAg, anti-HBC, HBeAg, anti-HBe. Here the right answer is going to be option C. This question asked in NORCET, repeatedly asked in the exam. So here the right answer is option C, that is HBeAg. So right answer is option C. What about other options? HBsAg, it shows hepatitis B infection is present. HBsAg, surface antigen, it shows hepatitis B infection is present. HBeAg, E stands for yearly antigen. It shows active replication and high infectivity. And next one, anti-HB, anti. Okay, so here it shows low infectivity and recovery phase. Anti-HBC with IgM immunoglobulin, it shows recent infection, acute infection. Anti-HBC, same, IgG immunoglobulin. Previously IgM, now IgG. It shows past exposure. Already the patient exposed with the infection. And anti-HBs, immunity means recovery period, vaccination period. Okay, so for which marker what is going on, that is very, very important. That's why I added these golden parts. Next question, a nursing student is studying the anatomy of the small intestine and learns about the circular fold in the small intestine that helps to increase the nutrition absorption. The teacher explained that this fold is called as valvulae connivens. So these valvulae is mainly present in which part of the intestine? Large intestine, duodenum, ileum, and jejunum. 4 options. Already they have mentioned small intestine so that we can exclude the large intestine. So leftover option is duodenum, ileum, and jejunum. So where the valvulae is present? It is present in the jejunum. It is used for the absorption. Where it is present in the jejunum. What about the structure? You can see this is called as what? This zigzag structure is called as what? Valvulae. This one, zigzag structures. Okay, right? And this structure is used for the absorption. Okay, question number 40. A child arrives at the emergency department after the tooth get knocked out. Tooth came out. During the sports activity, the nurse advises the parents to place the avulsed tooth. Avulsed tooth means the tooth which came out, that is called as avulsed tooth. So this avulsed tooth is going to reimplant again. So till reimplanting, where it should be kept? In which medium it has to be kept? Oil, cold water, milk, warm water. 4 options are there. So it is a direct question, and here the right answer is going to be option C, that is milk. Once the tooth is avulsed, that is avulsed tooth, we have to kept in the milk medium so that you can maintain the cell viability of the tooth, and the milk is having a suitable pH to protect the tooth, and it readily available. The milk is readily available. Easily we can drop in the milk, and the milk is the one which preserves the tooth till the transplantation. Understand, right? So that's why we have selected a medium called as milk. Okay, right? So like this, if you want the questions, MCQ discussions, again and again, you want to watch these type of MCQ magic pill sessions, previous year question paper discussions, so just subscribe e-nursing Metier YouTube channel. And from the Metier side, continuously we are providing NORCET pattern test weekly 2 times, and the MCQ discussions, live discussions weekly 3 times, and evening classes are going on. So if you want to clear the exam in the first attempt, join us. You can call us in the number which is mentioned in the bottom. Okay, so as early as join us and clear the exam in the first attempt, and all the best for your upcoming exam.